So I will try to give you an overview of what is our current strategy and some of the actions we are taking in order to address emerging infectious diseases in Europe and globally. So first of all, what are the overall objectives of our strategy and actions is to improve the prevention and early detection on infectious disease threats in Europe and globally, to promote a One Health approach, to develop the pipeline of medical countermeasures against prioritized or the unexpected pathogens. So I think very much in line with what the two previous speakers have just highlighted as some of the challenges and the needs, and also to ensure that we have a comprehensive research response that we swiftly can launch when we have an outbreak, because we can, of course, do a lot of research before the outbreak, but there's still research needed during the outbreak. And finally, also to facilitate a global collaboration in line with the WHO's blueprint. So, what are the type of research priorities that we are looking at? So, first of all, regarding prevention, one component is, of course, to better understand what are the drivers for outbreaks, including climate change, urbanization, etc., and of course also the zoonotic diseases, etc. We are working also on improving the surveillance and the early detection, looking into how to improve these areas. We work not only on the challenge in the low and middle income countries or in the south, but also in what are the main challenges as just described by ECDC for Europe. So we do work a lot on flu. We work a lot, of course, on antimicrobial resistance, but we also work a lot on the vector-borne diseases. Then the other research priority is to see how can we advance the pipeline of the medical countermeasures, so what is the core of our discussion in particular today, and also make sure that when we have the outbreak, how can we launch the clinical research that are needed. I put in red the social sciences, which we believe is absolutely very important, and we probably haven't done enough. We are now trying actually to integrate it very clearly in our research projects. What is also the research priorities is, of course, to improve also the health systems, see how that can, of course, we cannot with research build the improved health system, but research can give some input to how a health system and healthcare service can be more efficient in handling outbreaks, and not least also to contribute to the capacity building in the countries to be able to react and, among others, have the right human resources to do the clinical trials, etc. So what are the main funding instruments that we use? We have mainly four that we mobilize to fund preparedness research as well as response under our current framework program, Horizon 2020. First of all, the collaborative research that foster the collaboration between countries, sectors, and disciplines, and there are several of the societal challenges in particular that contribute. One is the Societal Challenge 1, so where I work on the health, but there's also the agricultural program or the bioeconomy program. There's the Societal Challenge for Societies and the security program. So all are contributing, as well as our specific program on research infrastructures. Then IMI is one of our instruments as well as the European and Developing Countries Clinical Trial Partnership, and that is a partnership between Europe and Sub-Saharan African countries that in particular fund clinical trials, and you will later hear about their specific activities. And then finally, we have a new instrument where we don't give grants, but we give loans to companies or academia or institutions that are working in the field of infectious diseases, and that is an initiative we have set up with the European Investment Bank. So these are the main funding instruments. You may ask why all these instruments? Because we experienced over the many years that we have been running funding programs that not one funding instrument fits all the needs and the key players. So therefore, we have are working on different instruments to make sure that we foster innovation in this space and that we get the key players involved. And specifically, we have been working a lot also on integrating the small and medium-sized enterprise into the space of infectious disease research. We have developed two main instruments in order to make sure that we quickly can respond to an outbreak. Among others, we have built in flexibility in ongoing projects, so we can actually, those that we are funding, and we have used it, that are relevant in the case of an outbreak, so that we use both for the Ebola outbreak and now for the Zika outbreak. We ask them, what can you take on some of the research needed rapidly? And that was done in a number of projects. And we also have now the flexibility in our financial regulation that allow us to award grants without a call for proposal. Because when we have to issue a call for proposal, it takes quite a long time before we get the projects up running. And this we used in my department for the Ebola outbreak. And we managed to get within, from when WHO announced it in August, September, we had 2 months afterwards the projects up running. So in these slides, I'm just giving you some examples of the research project that we currently are funding addressing these different research priority. It's not a complete list, but gives you some examples, and some of them you will actually hear later today giving a presentation. So we try, of course, to address all these areas. Clearly, what the Commission can do is not what is needed. There is general gaps in all these areas because it's a huge challenge. We've had a number of calls recently. One is still open because it's constantly open call, which is actually under IMI. So that is the Ebola Plus call. And then the agriculture program, the infrastructures, and our own program have had recently a number of calls that is coming to that have closed. But there's one on understanding the animal host pathogen environment interactions. We have had one on vaccine development for malaria and neglected infectious diseases, including emerging infectious diseases. And we will actually be funding projects both on Zika and yellow fever among the projects that are selected. And now under negotiation, we have an infrastructure on vector-borne diseases. And we also have a research infrastructure on vaccines development in particular. And we had a specific call on Zika this spring. And maybe I can just give you a few more information specifically on what we are doing now on the Zika virus. With the specific call we had, we are currently negotiating 3 big projects. We managed to raise, we started with 10 million, but we managed to raise more money, so actually we raised 30 million to address the Zika research gaps, and these projects are now working on clinical studies. They are working on particularly on the natural history and clinical spectrum of the diseases, the transmission modes, diagnostic development, mathematical modeling, etc. We have also negotiated that these projects need to work closely together, so they are now developing and implementing a harmonized data collection and are developing a data sharing roadmap. An important area for making sure that, of course, we use public money in the best way, but also that the progress is made in the quickest possible way. I have to say this is not something that you are just doing overnight. It's quite complicated to get this up running, and we still have a way to go, but I think we managed with these projects to actually do some concrete experience on how to implement a harmonized data collection. Finally, with these projects, we will build preparedness research network in the Latin American region. We still have some open calls under the EDCTP2, so I'm sure Michael will explain a bit more what EDCTP is doing, but among others, EDCTP has a call where also we aim to set up a network for preparedness in sub-Saharan Africa countries. We are participating in a number of international initiatives, such as the Coalition of Epidemic Preparedness Innovation that you will hear about in a few minutes. We are participating in the International Research Consortium on Animal Health, and finally we are participating and also chairing the Global Research Collaboration on Infectious Disease Preparedness, GLOPIDAR. And just a few words about what the GLOPIDAR network is doing. So we started actually before Ebola, Zika, and so on. We started back in 2013, bringing around a handful of public research funders around the table saying, well, we need to find a better way of coordinating our efforts when we have an outbreak and also be better prepared. This network have now extended to 25 major funders around the world. We have set the goal to be able to react in a coordinated way within 48 hours of an outbreak, which does not mean that we necessarily are going to make a call for proposals, but at least that we discuss together what are the needs, what are each of us doing, and what can we do jointly. We work, of course, very closely with the WHO, who is observer in the network, and we have worked closely together also a bit on Ebola, but here I have to confess we were taken a bit by surprise. We were not well organized yet, but we have worked very closely on Zika and as well as on yellow fever. So currently we have some working group on Zikas, and we are now bringing together what the GLOPIDAR funders are funding in the Zika space in order to see how we further can foster the collaboration between the projects. And we are working on data sharing, and we are working also on a readiness plan, and we have actually also a working group on yellow fever. I just wanted to highlight, I'm sure many of these things you have already seen, and it's not coming as a surprise, but I just want to highlight, and also I think it's important also when we discuss today, is that research alone is not enough. It's an important part, but alone it will not be able to solve the problems during an outbreak. And there's a lot of other issues that needs to be in place, from data sample sharing framework, how to move the samples across the world. The regulatory, and we will have a presentations from IMA today, the liability, the insurance issues, complex issues, the large-scale manufacturing, how do we get that funded, how do we ensure that when we actually have the vaccines, etc., that we also have, that the people who need it have access, and the IP issues, and many other aspects, such as how to make sure that there is a strong health system and services, in particular in the low and middle income countries, which certainly we experienced during the Ebola crisis, that was a major challenge. So with this,